use the machine, you need quite a bit of training as well, correct?
Yeah, yeah. Well, that's another reason why you only find these machines in a few clinics, because the training is actually done through the University of Florida, Gainesville, the Gators program down there. They have a really high-end spinal, actually sports rehab program, and that's where the Med-X machinery was first developed. It was actually developed by the same guy that produces, you've seen in the gyms, Nautilus equipment. It's the same producer, the same guy that produced Nautilus equipment. This was produced, however, specifically for rehabilitation purposes.
So insurance companies would like this then, or workers' comp, so they could qualify
love it.
the results and they could see where the muscle testing
Absolutely,
is.
yeah, they love it. Again, one of the biggest problems with traditional rehab and personal injury cases, for instance, that's a thing that we see time and time again. Someone gets injured in a car accident and there isn't necessarily broken bones or lacerations, but you've got soft tissue injuries. And soft tissue injuries are notorious for being difficult to prove in court in terms of, a patient walks in, they say my neck hurts, my back hurts, it's weak, whatever. The patient gets a certain number of treatments. The insurance company is supposed to pay for X number of treatments, but a lot of times they'll cut the treatment short because they say, well, according to most guidelines, this patient should be better by now. But you can't arbitrarily put a number on any one patient and say this patient needs 12 visits, everybody needs 12 visits, whatever. Everybody's different. So depending upon the severity of the accident and or the trauma, everybody's going to need different. Patients from this program were initially tested at the University of Florida, and a lot of the statistics that you see on the equipment itself, they've done ancillary studies to show, again, bone density, hip especially, because the hip is locked into place, but it's isometrically held there. There's still a lot of force and pressures that go through the hip, but it's done under a controlled environment, so it actually creates more bone density for people. But again, the purpose here is to strap down this axis through the hip here, and we do so by holding the upper thigh in place. The lower thigh is locked into place, and actually by using this swivel pedestal, if you will, we can drive the lower leg up, which basically reflects the tibia here, the bone in the bottom of the leg, through the knee joint, attaches to the femur, which is the main bone in your upper leg. Now the femur is then driven back, all the way back through this sort of deflection of this bone coming up and pushing underneath this pad. It's deflected into a lumbar restraint, or a lumbar roll back here, and that effectively takes the pelvis and just locks it into place underneath the roll. So as you'll see in a second here, when I restrain the patient, now the only complaint that we get typically from patients about this is that it's too tight. I mean, you want to be at the point where you're literally like on the fringe of cutting off circulation. Now, this sounds uncomfortable and nasty, but it's only, the patient's only in there for a matter of minutes. And we always, when we have a patient tied up, like I haven't tied her up as tight as I would normally go on this here,